Welcome to the deep dive. Today, we're really focusing in on macular degeneration.
Yeah, we've been looking at this really interesting discussion between an ophthalmologist, George Rozakis, and a biochemist, Brian Bake.
And our mission really is simple. Just pull out the crucial information you need about this condition. Get it to you quickly.
Exactly. We've gone through their talk, their presentation, to kind of extract the key things, the stuff that really matters for you as you navigate this.
Okay, so let's start unpacking it. One of the first things that really jumps out is, well, how vital early diagnosis is.
For better outcomes, right?
Definitely. And they talk about this test, the ADPTDX. It seems it can spot potential issues before any structural damage actually happens in the eye.
How does that work exactly?
Well, what's interesting is it checks for risk at the cellular level, even before you can see changes in the macula itself.
Okay.
It basically measures how fast your vision recovers after you look at a bright light. If it's slower than normal, that can be, an early warning sign. So you're catching problems in the eye's function, like way before the structure breaks down.
Exactly.
It really drives home that whole idea of, prevention being the best cure,
Right.
nipping it in the bud.
Precisely. The idea is if you can intervene early, address the biochemistry of the macula before that damage becomes irreversible,
Yeah.
well, that's your best shot.
And, for you listening, if you have a family history of macular degeneration, this 8-AKD-DEX test sounds like, well, a really smart thing to maybe ask about.
Yeah, you could ask your doctor for a referral, perhaps, to someone who offers it.
So that leads to the next big question. What actually causes this? Because it's clearly not just getting old, like you sometimes hear.
Right, that's a bit simplistic. They point to really specific things. Oxidative damage, that's damage from unstable molecules, inflammation, issues with DNA repair in the cell.
And hormones, too.
And even hormonal deficiencies, yeah. It seems to be a mix of underlying factors going wrong at that cellular level.
Okay, and how does aging fit into that then?
Well, aging can sort of weaken the body's natural defenses over time, makes it harder for cells to fight off those damaging factors. Like our cellular resilience just declines a bit.
But the key point, it seems, is that we don't just have to shrug and say it's aging. The goal is actually to treat these specific underlying issues.
Exactly, to kind of reactivate the cell's own defense mechanisms against these problems.
So how do you even figure out which of these underlying causes are at play for an individual?
And that's where blood testing comes in. They see it as a really crucial tool.
Which brings us to something that sounds pretty different. Apparently, this group is like the only one in the country routinely using blood tests specifically for macular degeneration.
Yeah, that seems to be their unique approach. It's not standard practice in ophthalmology.
What does that involve?
They have a schedule. You get a baseline test first, then another one at 3 months to see how things are changing with interventions.
Yeah.
And then it's roughly every 6 months after that. It allows for a really personalized plan, addressing your specific needs or deficiencies, not just a generic approach.
And it sounds like there's a real connection when people follow the plan. The improvements in their blood work often mirror improvements in their overall health.
Absolutely. The science connects these blood markers to AMD risk and progression. And the benefits aren't just in the eyes.
Right.
They've seen improvements in kidney labs, joint pain getting better, less inflammation generally, mood, sleep, even skin, hair, gut health.
Yeah.
Things you might just put down to aging.
And crucially, those important cells in the eye, the RPE cells, the retinal pigment epithelial cells.
Yes, vital for vision.
They seem to respond well when the treatment is guided by these blood tests.
Which really makes you wonder, doesn't it?
Yeah.
Why hasn't detailed blood testing been standard for a blinding disease like this? It feels like a missing piece.
It's almost like, the history they describe, those early vitamin studies. It sounds like maybe they weren't even designed to find the best approach.
Yeah, there's a suggestion maybe the initial goal was almost to disprove vitamins, and then when AREDS showed some benefit, there wasn't much push to find something better or more personalized. A missed opportunity, perhaps?
So instead, they applied this functional medicine approach to macular degeneration.
Right. Looking at the whole system, the root causes, and personalizing the treatment. That holistic view is what they say led to the res they're seeing.
So it kind of builds on AREDS, but goes way beyond just a standard vitamin pill.
Much further, yeah. It's about finding your modifiable risk factors through testing and then tackling those specifically.
And what about the outcomes? What are they actually seeing?
Well, for dry macular degeneration, which is the more common form, they report vision stabilization or even improvement in, get this, 48% of patients in their study.
Almost half. That's significant, and it really hammers home that point about treating it early, doesn't it?
Definitely. Less irreversible damage means a better chance to hold on to vision, maybe even regain some.
And what about wet macular degeneration?
For wet AMD, they report a 60% improvement in management. Now, wet AMD involves this factor called VEGF.
Vascular endothelial growth factor. That's what triggers the leaky blood vessels, right? And what the injections target.
Exactly. But their program, interestingly, can actually help lower those VEGF levels naturally.
Which could be huge, especially for someone with dry AMD, potentially lowering the risk of it converting to wet.
That's the idea. And even if you already have wet AMD and are getting those injections, their program can work alongside them. They've seen clients potentially need fewer injections over time.
That's important because those VEGF injections, while necessary sometimes, they don't actually make the macula healthier, do they?
No, they just stop the leaking.
Yeah.
They don't fix the underlying reason why the VEGF is high in the first place.
So you could end up in a cycle. Block VEGF, it builds up again, need another shot.
Potentially, yes. Their program aims to break that cycle by addressing the root causes driving the VEGF production.
Plus, getting repeated injections in the eye, that has potential downsides over the long run too, right? Trauma, eye pressure.
It does. There are risks associated with any invasive procedure, especially repeatedly over years.
So time is really critical here. Getting onto a program that addresses the fundamentals seems key to preventing that permanent damage.
Absolutely. And potentially reducing the need for those constant interventions.
And the long-term picture sounds quite positive too.
Yeah, they talk about patients showing continued stability or even slow, steady improvement over months, even years on the program.
That's encouraging.
They even shared some anecdotes, like long-term clients whose own retina specialists eventually said, you know what, you don't need to come back anymore, which is pretty remarkable.
Wow. Okay, let's switch gears slightly. Cataracts. A lot of people deal with both cataracts and macular degeneration. Is cataract surgery a problem?
It can be. Sometimes cataract surgery can make existing macular degeneration worse.
Yeah.
That's a known potential complication. But they generally don't see that worsening effect in patients who are already on their program before having the surgery.
Ah, okay. So the recommendation is, if you have both, try to get the macular degeneration addressed first with their program, if possible.
That seems to be the advice, yeah. Get the macula healthier before the stress of cataract surgery. Could help avoid that post-op dip in vision.
It makes sense. What about diabetes, another common condition? How does that interact?
Yeah, diabetes is a big one. It can definitely make macular degeneration worse, accelerate it.
But the program helps diabetic patients too.
Yes, it's designed to support them and their macula health. And again, blood testing is key.
How so?
Because the tests can pick up on blood sugar issues even before someone is officially diagnosed as diabetic, in that pre-diabetic stage. Allows for earlier intervention.
And fundamentally, it's about cell health again, isn't it?
Exactly. Improving the health of those RPE cells in the eye, which are hit by macular degeneration, but also improving the health of cells affected by diabetes, like the ones involved in blood sugar control.
So the benefits really ripple outwards. It's not just about the eyes.
Absolutely not. They emphasize their programs aim to improve general health overall.
Right. Addressing those risk factors found in the blood tests helps cells everywhere, you said, like kidney cells, pancreas cells.
Exactly. Beta cells for blood sugar, kidney cells, joint tissues. It ties into, anti-aging principles, functional medicine, integrative health, helping the body heal itself.
Tackling things like hormonal decline, which you mentioned earlier.
Yeah, things that are often seen as just part of aging, but might actually be reversible or manageable issues.
So it's this comprehensive attack, isn't it? Hormones, oxidative stress, inflammation, nutrition.
That multifaceted approach seems to be why they see these broad benefits.
Okay, what about other therapies people might hear about, like red light therapy? What's their take?
Well, they say they're open to anything that actually works. Their stance is pragmatic.
So what does the data say on red light from their perspective?
From what they've seen, it doesn't seem to show significant improvement in vision. Maybe more stabilization? And they kind of question the premise, too. Like, did macular degeneration start because we're deficient in red light? Seems unlikely. Plus, it can be pretty expensive.
Right. So their focus stays on those root causes we've been talking about: oxidation, mitochondria, hormones, inflammation.
Yeah, those are the established drivers they target. They acknowledge red light might help mitochondria, which are the energy factories in cells, but they seem uncertain about how much real-world vision benefit that translates to, especially weighed against the cost. And there's a difference between home devices and those pricey clinic treatments.
Did they mention specific studies?
Yeah, they mentioned studies showing maybe only a couple of letters improvement on the eye chart, and sometimes the control groups improved almost as much.
So it's not something they'd recommend up front.
It sounds like they see it as maybe something to consider after their core program is in place, perhaps as a complementary thing, like injections. They're open to hearing from patients who try it.
Okay, so bottom line on red light. Costly, maybe minimal vision gain based on current data, potentially a later add-on, but focus first on the root cause.
That seems to be the gist, yeah.
What about geographic atrophy? That sounds serious.
It is. It's a patch of the retina that degenerates, kind of like a localized bald spot. There's a big push now for eye injections to try and stop those spots from getting bigger.
Okay. What have they observed?
Interestingly, they report not seeing progression of geographic atrophy in patients who are on their program.
Really? So the program itself might help stop it.
It suggests it might, yeah, potentially reducing the need for those specific geographic atrophy injections.
So if someone has geographic atrophy, what are the options?
Well, they could go ahead with the injections as recommended, or they could try the program, but with very close monitoring by their eye doctor. Geographic atrophy tends to progress slowly, so there might be time to see if the program helps stabilize it.
And again, those injections aren't risk-free.
Right, there's always that potential downside with injections to consider.
Are there other types of macular diseases, not just age-related?
Yes, definitely. Things like retinitis pigmentosa, which is inherited,
Yeah.
other types of retinal degenerations.
Can the program help with those too?
They believe so. Their thinking is the underlying principles of cellular health apply broadly. They've shared anecdotes of slowing progression, stabilization, even some improvement in these non-AMD conditions, too.
So basically, if you have any kind of retinal degeneration problem,
It's worth reaching out to them to see if their approach might be relevant.
it really feels like the expertise behind this is key. You've got the biochemist, PhD, with a nutrition master's,
Reinbeck, yeah.
and the ophthalmologist with decades in functional medicine.
George Rizakis. That combination is pretty unique.
And it sounds like they didn't even start out focusing on the eye.
No, apparently they were treating the whole body using functional medicine principles and then noticed these significant benefits for eye health, which led them down this path.
That unique skill set seems to be why they can offer this, the blood testing, the personalized plans. It's just not typical eye care.
No, and they're somewhat critical of how ophthalmology in general has approached functional medicine, basically stopping at the ARDs as vitamins.
Lacking the deeper biochemical and nutritional training, perhaps.
That seems to be their point. And maybe now leaning towards things like red light therapy because it's simpler, even if potentially less effective or more costly, than digging into the complex root cellular issues.
So the core message keeps coming back. Macular degeneration is a cellular disease. Multiple causes. Treatable causes. And blood work is key to figuring it out.
Exactly. A functional medicine approach makes sense for a complex cellular degenerative condition.
Which leads to a really crucial point. Urgency. It sounds like people often wait too long.
That's a huge problem they highlighted. Waiting until vision is noticeably worse makes treatment much, much harder.
So if you get that diagnosis, maybe just drusen those early deposits or early macular changes?
Act then. Don't wait. The standard advice, just take AREs, eat kale, often isn't enough to stop it from progressing.
They use that analogy like a house fire.
Yeah. You wouldn't wait till the whole house is burning. You see smoke, you act immediately. Same with your vision. Put out the small fire before it becomes uncontrollable.
Because vision is just so fundamental to quality of life, isn't it?
Absolutely. Everything we do relies on it. Losing it is devastating. We need to be proactive.
And their initial evaluation, it sounds like they assess if there's actually enough vision left to save.
Right. If the damage is too extensive, like the house is burned down, realistically, reversal might not be possible.
What if one eye is already badly affected?
Then the focus often shifts intensely to protecting the better eye, doing everything possible to stop it going down the same road.
So the first step really is getting that blood work done.
At the very least, yeah. Understand your underlying issues. Then you can make an informed decision about a treatment plan.
And it's personal for them too, isn't it? Family histories.
Both of them, yes. Which is why they follow this approach themselves for prevention.
And that story about the mother, the first patient, stable for 15 years.
Over 15 years, yeah. A powerful testament to the potential of addressing the root causes early.
It really boils down to, if you have macular degeneration, don't wait. Fix it early before the vision loss happens.
That's the core message, loud and clear.
So for you listening, what's the practical next step?
It's pretty straightforward. Book a call with them. Discuss your specific situation. Learn more about the program directly.
And they mentioned, didn't they, that early stage cases are often easier to manage?
And less expensive to treat, too, usually. So acting sooner rather than later makes sense on multiple levels.
And really the whole point of this deep dive today was to arm you with this background information first?
Exactly. To answer a lot of those initial questions, so when you do have that call, you're coming from a more informed place.
Makes the conversation much more productive.
Absolutely. So we hope you take that step, and we look forward to maybe hearing how it goes for you.
Ultimately, isn't this about taking control? Understanding the root causes of macular degeneration gives you the power to be proactive about protecting not just your sight, but your overall health too. It's time to own your eye health journey.